morning, students. Today's class is on the vestibulocochlear nerve. The vestibulocochlear nerve is the eighth cranial nerve, and it is a nerve which is responsible for the most important sensation, that is the hearing sensation. So today's class we will talk about the origin of the cranial nerve, its course, its supply and the applied anatomy. So basically the cranial nerves are 12 in number, and the cranial numbers arise from the forebrain and also from the brainstem. Two of them arise from the forebrain, while 10 pairs arise from the brainstem. So this is the eighth cranial nerve, which is also taking its origin from the brainstem. So you know that the cranial nerves can be divided by giving functional columns, and it can be referred with the function that it is performing. So this particular nerve, vestibulocochlear, is it is a special somatic afferent nerve which is going to carry the hearing sensation. So it is a nerve which is responsible for the hearing purpose. It has basically three divisions, and that we call it as the special somatic afferent, and you will also have the special somatic feature, that is the hearing tendency, the hearing sensation being carried by this nerve to the brain through this nerve from the cochlea. So the fibers from the cochlea will condense to form the nerve fiber, and from the cochlea through the bipolar neurons it is taken to a spiral ganglion, and from there it is innervated. These processes will innervate the organ of Coti, and the hearing sensation is taken to the brain, the sensory cortex of the brain. Okay. So here you will also have the hearing area of the brain which responds to the sound that is received through the vestibulocochlear. So today's learning objectives will be the vestibulocochlear nerve's course. We will learn its area of supply, the functional components of the nerve and its applied aspects. Let's start with a small pretest. The cranial nerve that is responsible for hearing: A. Ophthalmic, B. Optic, C. Vestibulocochlear and D. Glossopharyngeal. Do give me the answer as a comment to this video. Let's talk about the fibers, the special somatic afferent fibers of vestibulocochlear. The vestibulocochlear is a nerve which is responsible for hearing, and it is necessary not only for hearing but for the maintenance of equilibrium. So whenever there is a disturbance to this nerve, the patient also complains of loss of equilibrium, giddiness, and the posture sense, a kind of a dizzy feeling always appears when there is a loss of maintenance of the equilibrium. The hearing, it is also responsible for the equilibrium and the hearing sensation. The main fibers arise from the membranous labyrinth of the internal ear, and the fibers carry the sensory information for the equilibrium. They terminate in the vestibular nuclei of the brainstem. So the fibers that start from the inner ear from the cochlea up till it is going to go to the brainstem, that is the vestibular nuclei of the brainstem. The fibers carrying the sensory information are for hearing, and they terminate in the dorsal and ventral cochlear nuclei, located respectively on their dorsal and the ventral aspects of the inferior cerebellar peduncle. So it is closely associated with the inferior cerebellar peduncle, and hence it also has its role on the maintenance of the equilibrium and posture. You know that cerebellum is one of the major parts of the brain which controls the equilibrium and posture. Here, through the inferior cerebellar peduncle, it does communicate to the dorsal and the ventral cochlear nuclei in the brainstem, and the vestibulocochlear nerve do influence on the postural sense and equilibrium of the patient. So the vestibulocochlear nerve is the eighth cranial nerve, and it consists of two distinct parts. The first one is the vestibular nerve, second is the cochlear nerve. So vestibulocochlear, we divide it into two equal segments, vestibular and cochlear. Okay, the vestibular nerve is concerned with the maintenance of equilibrium, while cochlear nerve is concerned with hearing. There are two parts in the vestibulocochlear. Vestibular is concerned with the equilibrium and cochlear is concerned with the hearing. The vestibular nerve arises from the lateral aspect of the pontomedullary junction, passes through the pontocerebellar angle, and enters the internal acoustic meatus. So from the vestibular nucleus that is located in the lateral aspect of the brainstem, where in the brainstem? Exactly at the junction of the pons and the medulla. That area we call it as a pontomedullary junction. So when it passes through the pontomedullary junction, it then enters into a foramen called internal acoustic meatus along with the facial nerve, and then it enters along with the labyrinthine vessels into the inner ear. So the internal acoustic meatus is the passage through which this nerve enters the cochlea and the labyrinth, okay, along with the labyrinthine vessels. The vestibular ganglion is also called as a Scarpa's ganglion and is located on the vestibular nerve in the lateral part of the internal acoustic meatus. So the nerve, as I said, has two fibers, one concerned with the equilibrium, and that part of the nerve is called as the vestibular nerve. The second part of the nerve, which is concerned with hearing, is called as the cochlear nerve, which enters through the internal acoustic meatus, enters into the internal ear, and ends itself in the cochlea. Hence, we give it the name cochlear nerve. And the vestibular nerve will end itself in a ganglion called Scarpa's ganglion, which is located in closer to the vestibular nerve in the lateral part of the internal acoustic meatus. Before it re-enters into the internal acoustic meatus, is said, the vestibular nerve will end up in a ganglion called Scarpa's ganglion. So this is a very neat image of the vestibular nerve getting divided. If you find here, this is the pontomedullary junction because this is the pons area and this is the medullary area, very clearly showing the pontomedullary junction. This is a pontomedullary junction, and in the lateral part of the pontomedullary junction, you get the vestibulocochlear nerve coming out from the vestibular nuclei that is located within the brainstem. So there are basically the lateral vestibular nucleus, the medial vestibular nucleus, and the inferior vestibular nucleus. You do have a cochlear, anterior and posterior cochlear nucleus as also. So the vestibular nerve arises from the vestibular nucleus, while the cochlear nerve is going to arise from the cochlear nucleus. Both of them are going to condense to form one nerve, but later they get divided before they enter into the internal acoustic meatus. Internal acoustic meatus is a passage for the nerve to enter from the brain into the internal ear. So before it enters, it gets itself divided into the vestibular part and the cochlear part. The vestibular part is going to end up in a ganglion called the Scarpa's ganglion, responsible for the equilibrium and the maintenance of equilibrium. So the cochlear nerve is the one which is going to enter into the inner ear, and this cochlear nerve is going to go to the labyrinthine, and from the labyrinthine it is also going to supply the cochlear to carry the hearing sensation. So what you see is all the vessels that are seen within the labyrinthine, and here you find the separation of the inner ear from the middle ear. This is the middle ear, and here you find the stapes, the incus and the malleus together. This is the tympanic membrane that separates the middle ear cavity from the external ear. So this is a cross section of the entire ear that has been shown very clearly in this image. So going to the further, we talk about the cochlear nerve first. The cochlear part of the vestibulocochlear nerve is made up of bipolar sensory neurons. It is in the lateral part of the internal acoustic meatus. The nerve divides into three distinct branches: the superior, the inferior, and the singular divisions. These branches pass through the foramina in the fundus of the meatus and innervate the sensory receptors for equilibrium, called as the cristae ampullaris, and maculae in the membranous labyrinth of the internal ear. So the purpose of the cochlear nerve is it has to carry the sensation of hearing. It is basically made up of bipolar neurons, and in the lateral part of the internal acoustic meatus, it enters into the cranium and divides itself into the superior. It leaves the cranium and enters into the inner ear, where it divides itself into the superior branch, the inferior division, and the singular division. These branches pass through a foramina in the fundus of the meatus and innervate the sensory receptors for the equilibrium, that is the cristae ampullaris, as well as the membranous labyrinth of the inner ear. So this is again the image that is shown, the arising of the vestibulocochlear from the lateral part of the pontomedullary junction that comes out of the cranium and enters into the internal acoustic meatus, laterally into the internal acoustic meatus, and there the cochlear nerve going directly to the cochlea of the inner ear, and the vestibular nerve directly going to the vestibular ganglia to give the equilibrium. But both of them are arising as fibers are located very close to each other, and they innervate the inner ear. So this is the inner ear. This is the middle ear getting separated from the inner ear, and this is the stapes incus and the malleus, and this is the tympanic membrane that separates the middle ear from the external ear. So, to talk about the course of this nerve, the cochlear nerve arises from the lateral aspect of the pontomedullary junction, takes a course into the internal acoustic meatus. Then, at the medial end of the internal acoustic meatus, it enters into the bony labyrinth of the middle ear through the tactus spiralis foraminacus, and in the fundus of the meatus, reaches the modulus of the internal ear. And in the modulus, the cochlear nerve possesses a sensory ganglion called spiral ganglion made of bipolar neurons. The peripheral process of these neurons innervate the sensory receptors of the hearing, and it's called as the organ of Corti. So this is the nerve which is going to innervate the organ of Corti for the sense of hearing as well as for the sense of equilibrium. It crosses the internal jugular vein and the vagus nerve. Along with the vagus nerve, it passes down in the deeper planes between the internal jugular vein and the internal carotid artery. So when it leaves the cranium, it comes along with the internal jugular vein and the internal carotid artery. Then the hypoglossal nerve is seen medial to all the other structures like the internal jugular vein and the internal carotid artery. The hypoglossal nerve is related medial to it around. Then it curves around the vagus nerve, which is also coming all along with the other structures, then passes forward superficial to the vagus nerve and the internal carotid artery, external carotid arteries, then in close relationship with the last four cranial nerves. It will be appreciated well by studying the features of the base of the skull around the jugular foramen. So closer to the jugular foramen, it leaves the cranium and enters into the internal acoustic meatus. So it is seen in close relation with the internal external jugular vein, the internal carotid artery, and the vagus nerve. When it comes out, it crosses the vagus nerve medially and the internal carotid artery medially. Later, it is also in close proximal relation with the last four cranial nerves. That is the hypoglossal accessory, vagus and the glossopharyngeal nerves, and later it enters into the internal acoustic meatus, leaving the cranium. So the vestibulocochlear nerve, it is out coming out through the jugular foramen. The vestibulocochlear nerve comes out through the jugular foramen located in the front of the jugular process of occipital bone. The jugular fossa is a bony depression between the jugular foramen and the base of the skull. The jugular fossa is a small depression that is seen between the jugular foramen and the base of the skull. So, what are all the lesions that are seen associated with this nerve? Though the course seems to be very easy, the function is very important. It is a special somatic afferent nerve. It should be very important because the functional component of this cranial nerve will be asked. And the main lesion associated with it is the tinnitus. The tinnitus is nothing but a kind of a ringing sound or a buzzing sound within the ear, which is very frequently encountered problem. So this is a lesion in relation with the vestibulocochlear nerve. An impairment of loss of hearing that is usually occurring congenital, or it could also be acquired. Okay, whenever there is a damage to the vestibulocochlear nerve, the sensation of hearing is lost. Then loss of balance, vertigo. Vertigo often comes with a kind of dizziness. The main clinical feature is a kind of dizziness, or a sense of loss of equilibrium. So this is because of the damage to the vestibulocochlear nerve. The vestibular nerve is commonly involved in by the internal acoustic neuroma. Usually the acoustic neuroma is a small lesion that is seen within the vestibular nerve, and it arises from the sheath cells of its own constituent fibers in the region of the cerebropontine angle itself. So the acoustic neuroma is nothing but a small tumor that arises from the fibers of the vestibulocochlear nerve itself from the point where it arises, that is the pontomedullary junction. And the acoustic neuroma is one of the common intracranial tumors, and if large, it may even involve the adjacent trigeminal, facial, and the glossopharyngeal nerve nucleuses, and it may compress the entire cerebellum and medulla. So this particular tumor, it grows in size, can compress the nucleus of the trigeminal, facial, and the glossopharyngeal, and it will compress the entire cerebellum along with the medulla when it is size increases. This is a course diagram that shows the course of the nerve. So this is a vestibular and the cochlear nuclei, and from here through the vestibular ganglion, which is like this is a schematic diagram, which is otherwise called Scarpa's ganglion. The fibers passes through the internal acoustic meatus. It is called the vestibular nerve. It goes to the macula and the crista ampullaris, responsible for the equilibrium. Simultaneously, to talk about the cochlear nerve, it is arising from the dorsal and the ventral cochlear nucleuses from the inferior cerebellar peduncular area, and it goes through the same internal acoustic meatus as the cochlear nerve. Then it enters into the spiral ganglion and goes to the spiral organ of Corti. So the vestibular nerve is concerned with balance arising from the vestibular nuclei, and the cochlear nerve is responsible for hearing, which arises from the dorsal and lateral cochlear nuclei in the contomedullary junction. So the cochlear nucleus is mainly located closer to the inferior cerebellar peduncle, and it enters along, it joins to form the cochlear fibers that enters into the internal acoustic meatus. So we should be clear about this two separate divisions of the vestibulocochlear nerve. So this is again a post test. Vestibulocochlear nerve has the following functional components. See all the functional components carefully and choose the right answer. Give me the right answer as a comment to this video, and you can also post the answers for the feedback. You can give me the feedback through the comments for the video. If you have any questions, please let me know as a comment, or you can even send it through the WhatsApp group. Thank you. There will be a questionnaire posted after this, which you are supposed to answer, and the attendance will be calculated based upon the post-lecture questionnaire. Thank you.